Hello, lovely people. Welcome back to my channel. This is Abdul Malik. Please, if you have not yet subscribed, kindly subscribe. You can also call me Experience 1. Today, we are going to look at disseminated intravascular coagulation, DIC. It's a condition that mostly occurs as a result of the clotting factors or the clotting cascade being overactivated. Now, whenever the clotting cascade is being activated, that you should know that the patient initially is going to have clotting factors and then increase, where clotting will be occurring within the microvascular circulations. And at the end of the day, what happened? The platelets count is going to be reduced, and then the end result is that the patient is now going to start bleeding, having a hemorrhage, due to the fact that the platelets have been reduced, and then the patient is having bleeding tendency. So this condition is a bit dicey when it comes to the pathophysiology, how they occur. Now, I would like you to know that this particular program is being sponsored by American Dream NCLEX Prep. So please contact us for all your NCLEX needs. Now, let's come back to our channel, our main discussion. DIC is a condition in which the clotting cascade is activated, resulting in the formation of clots in the microcirculation. Now, we are saying that whenever the clotting cascade is being activated, what happens is that the patient is initially going to have clot within the microcirculation. So there's going to be a clotting at the initial stage. Then after this, the platelet counts are going to be decreased, thereby causing the patient bleeding. This is very dangerous. And the clot in DIC causes platelets and clotting factors to be depleted, leading in bleeding and the potential vascular occlusion of organs from thromboembolus formation. This is very, very dangerous. Now, let's look at the predisposing factor, because there are a lot of factors that can lead to this particular one. Some will say, what are the causes predisposing? What are those things that can lead to DIC or disseminated intravascular coagulation? Placenta abruption. Placenta abruption can lead to this. And then also amniotic fluid retention. Whenever the amniotic fluid retained in the body, you know the consequences that is going to happen, especially when we do amniocentesis, and then we have this particular amniotic fluid being leaked out. There is a likelihood that this particular condition is going to occur, or retention of amniotic fluid, fluid embolism. This is very dangerous. Amniotic fluid embolism, amniotic fluid being leaked out into the blood. This particular thing can cause DIC to occur, especially when it comes to the amniocentesis and those procedures that we do. And then also gestational hypertension, increase in blood pressure in pregnancy can lead to DIC. We have HELLP syndrome, and then also intrauterine fetal death. Whenever the fetus in the uterus or a pregnant woman loses the baby in the uterus, this thing can happen, especially when the uterus die. For some time, if identification is not in the pipeline for us to determine that this particular fetus is dead, then it means that with time DIC will start occur. And then also liver diseases, sepsis, and then severe postpartum hemorrhage. All this can be the predisposing factors for disseminated intravascular coagulation. So please let us take notice of this. And then also let's look at the assessment. When they occur, what will be the assessment finding? Uncontrolled bleeding. This particular area is very important. Uncontrolled, because the patient is going to bleed severely. Because take note, the platelet counts have been depleted, so the patient is not going to bleed. So what happens is that now whenever the clotting factors or the clotting cascade being activated, definitely if I'm strong, I'll overactivate. So what happens is that there will be some form of what? Clot, because of the high amount of the clotting issues at the initial stage in the microcirculations or in the tiny vessels. So it means that we need the body in its own mechanism, homeostasis will have to set in order to have the clotting to be dissolved. So the platelet counts and other clotting activities will start to deplete, to go down. And then what happens is that the patient is now going to bleed. So you see that when it comes to the management, heparin is needed. Why the heparin? Heparin prevents what? Clotting. So we need a heparin in this particular case. It's one of the cardinal or important pharmacological management when it comes to disseminated intravascular coagulation or DIC. So uncontrolled bleeding is going to occur, and then bruising, purpura, petechia, and ecchymosis are all going to happen. And then hematuria, blood in the urine, is also going to occur. And then blood in the stool, melena, blood in the stool will also occur. And then increased prothrombin time, and then prolonged clotting time. So it means that when the patient gets injured, the probability of the clotting happen is is low, because here's the case, the patient has a bleeding tendency. So take note of that. Now let's look at how we'll be able to intervene. There are a lot of management. One, you need to prevent falling, because when the patient falls and gets injured, bleeding is going to occur. And then we should reduce the way we do injections. Injections are also supposed to be restricted or limited in this particular case, because the patient can have uncontrollable bleeding. So let's take notice of that. And then we need to check the vital signs of the individuals, especially when it comes to the pulse rate, to see, and the blood pressure, to see whether the patient is going into shock. We need to assess for bleeding tendencies, the area, especially when it comes to the orifice, to see if the patient is bleeding. And then oxygen therapy is also needed. Oxygen. Also, we need to transfuse the patient, especially when we know that this patient is bleeding severely. And then we need to give a blood product that contains clotting factors, in order to help this particular patient stop bleeding. And then we can do heparin therapy, because of the clotting that they initiate within the vascular circulation. We need to try to dissolve the clot in order to help this particular patient. And then we need to monitor urine output, because you know that when the patient bleeds uncontrollably, kidney failure can occur. So we have to monitor the patient urine output in order to see if the kidney is not affected. And now take note, we have to limit injection in this particular patient. Once again, this particular content is being sponsored by American Dream NCLEX Prep. Thank you very much once again. Please contact us for all your NCLEX needs. Have a nice day. Bye-bye.